Hello everyone. This is a short video on information related to coronavirus vaccination program. Before I reveal information on coronavirus vaccination and immunization program in this video, I have a short disclaimer to avoid copyright issues. The disclaimer is the information provided in this video is taken from official websites and in some cases unofficial websites. I'm just an aggregator of the information. Please check both the official and unofficial websites mentioned in the description at the end of this video. Human body's natural response. Germs or pathogens, which are disease-causing organisms such as bacteria, virus, parasite or fungus that can cause disease within the body, are all around us, both in our environment and in our bodies. When a person is susceptible and they encounter a harmful organism, it can lead to disease and death. The body has many ways of defending itself against pathogens through skin, mucus, and cilia, which are microscopic hairs that move debris away from the lungs. All work as physical barriers to prevent pathogens from entering the body in the first place. When a pathogen does infect the body, our body's defenses, called the immune system, are triggered and the pathogen is attacked and destroyed or overcome. Each pathogen is made up of several subparts usually unique to that specific pathogen and the disease it causes. The subpart of a pathogen that causes the formation of antibodies is called an antigen. Antibodies produced in response to pathogens' antigen are an important part of the immune system. What are antibodies? You can consider antibodies as soldiers in your body's defense system. Each antibody or soldier in our system is trained to recognize one specific antigen. We have thousands of different antibodies in our bodies. When the human body is exposed to an antigen for the first time, it takes time for the immune system to respond and produce antibodies specific to that antigen. In the meantime, the person is susceptible to becoming ill. Once the antigen-specific antibodies are produced, they work with the rest of the immune system to destroy the pathogen and stop the disease. Antibodies to one pathogen generally don't protect against another pathogen except when two pathogens are very similar to each other, like cousins. Once the body produces antibodies in its primary response to an antigen, it also creates antibody-producing memory cells which remain alive even after the pathogen is defeated by the antibodies. What are antigens and how does a vaccine work? If the body is exposed to the same pathogen more than once, the antibody responds much faster and more effective than the first time around because the memory cells are ready to pump out antibodies against that antigen. This means that if the person is exposed to dangerous pathogen in the future, the immune system will be able to respond immediately, protecting against disease. Some vaccines require multiple doses given weeks or months apart. This is sometimes needed to allow for the production of long-lived antibodies and development of memory cells. In this way, the body is trained to fight the specific disease-causing organism, building up memory of the pathogen so as to rapidly fight it if and when exposed in the future. All vaccines contain an active component, that is the antigen, which generates an immune system or the blueprint for making the active component. The antigen may be a small part of the disease-causing organism like a protein or sugar, or it may be the whole organism in a weakened or inactive. How vaccine protects those in herd immunity? When someone is vaccinated, they are very likely to be protected against the targeted disease, but not everyone can be vaccinated. People with the underlying health conditions that weaken the immune system, such as cancer or HIV, or who have severe allergies to some vaccine components may not be able to get vaccinated with certain vaccines. These people can still be protected if they live in and amongst others who are vaccinated. When a lot of people in a community are vaccinated, the pathogen has a hard time circulating because most of the people it encounters are immune. Current situation in the world. Globally, as of 9th January 2021, there have been close to 88 million confirmed cases of COVID-19, including close to 2 million deaths reported to World Health Organization. What's the current situation in India? In India, from January 3rd to January 9th, 2021, there have been close to 11 million confirmed cases of COVID-19 with 150,000 deaths. We have the link here, which covers the state-wise COVID hospitals in India. Why is this new strain of coronavirus causing concern? The new variant is unusually highly mutated. The most likely explanation is the variant has emerged in a patient with a weakened immune system that was unable to beat the virus. Instead, the body became a breeding ground for the virus to mutate. That 7% number appeared in a presentation came from Imperial College, London. The virus that was first detected in Wuhan is now the same one you will find in most corners of the world. The D614G mutation emerged in Europe in February and became the globally dominant form of the virus. Another, called A222V, spread across Europe and was linked to people's summer holidays in Spain. An initial analysis of the new variant has been published and identifies 17 potentially important alterations. There have been changes to the spike protein that is the key the virus uses to unlock the doorway to our body's cells. One mutation called N501Y alters the most important part of the spike known as the receptor binding domain. This is where the spike makes first contact with the surface of our body cells. Any changes that make it easier for the virus to get inside are likely to give it an edge. The other mutation, H69/V70 deletion, in which a small part of the spike is removed, has emerged several times before. Does the coronavirus mutation affect the available vaccine? The virus will probably be able to generate vaccine escape mutants. Viruses mutate all the time. They try to adapt to the environment for survival. Vaccines train the immune system to attack several different parts of the virus, so even though part of the spike has mutated, the vaccine should still work. Vaccines prompt your body to develop many different types of antibodies as well as T-cell immunity, that is, memory cells in your immune system, which may completely take care of this and all of the novel coronavirus strains. New research on T-cells and COVID-19 has found that they may help protect some people who are newly infected with SARS-CoV-2 by remembering past encounters with other human coronaviruses. Even if vaccines are out, we should continue to wash our hands frequently, social distance from those outside our household, and wear a mask when we are in public. Stakeholders in India's vaccination program. India is embarking on one of the world's most ambitious mass immunization programs ever undertaken after regulators approved the country's first two COVID-19 vaccines for restricted emergency use. These vaccines won't be available to other countries until March or April, as the Indian government has restricted them for export. This is not going to go to the private market, private hospitals, and other places right now. Serum Institute of India and Bharat Biotech have been given a restricted license to only give it and provide it to the Government of India because Government of India wants to prioritize for the most vulnerable and needy segments in India first. The stakeholders are Ministry of Health and Family Welfare, Serum Institute of India, Indian Council of Medical Research, and Bharat Biotech. Vaccines developed by India. Drugs Controller General of India is the head of the Department of Central Drug Standards and Control Organization, and it comes under the Ministry of Health and Family Welfare of the Government of India. It approves licenses, sets standards for manufacturing, sales, import, and distribution of drugs in India. DCGI approved two coronavirus vaccines, one developed by Serum Institute of India and the other developed by Bharat Biotech. Both vaccines will be administered in 2 doses and stored at standard refrigerator temperatures of 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit. What other vaccines are under consideration? Covishield and Covaxin we have just discussed. The others are Zycov-D. The manufacturer is Cadila Healthcare Limited. And Sputnik 5, trialed and manufactured in India by Dr. Reddy's lab. NVX CoV2373, manufactured by Serum Institute of India. Recombinant protein antigen based vaccine, manufactured by Biological E Limited. HGCO19, manufactured by Genova. Inactivated rabies vector platform, manufactured by Bharat Biotech. Vesulo Vax platform, manufactured by Aurobindo Pharma Limited. 3 vaccine makers have applied for an emergency use authorization of their coronavirus vaccines in India. These are Pfizer, BioNTech, Serum Institute of India's in collaboration with Oxford AstraZeneca for its Covishield, and Bharat Biotech in collaboration with ICMR for its Covaxin. So far, only Covishield and Covaxin have been granted approval. Manufacturing, supply and distribution of vaccine worldwide. Ahead of the mass vaccination drive, the Indian government has also been recruiting and training additional vaccinators and ramping up its stocks of cold chain storage equipment such as walk-in coolers and freezers, deep freezers, and ice-lined refrigerators over the past few months. Officials said 154,000 of country's 223,000 nurses and midwives engaged in this program will be deployed to give COVID vaccines to people. It will be also inviting final year nursing students to volunteer. Some 29,000 existing cold storage facilities would be used to stock the vaccines. Nearly all vaccines needed to be transported and distributed between 2 degrees Celsius and 8 degrees Celsius in what comprises the so-called cold chain. CoWin Vaccine Delivery Management System in India. India already has a vast established network under its Universal Immunization Program, which inoculates about 55 million people every year. Analysts have said that means the country's health system is relatively well geared up for the COVID-19 vaccinations. Once the app becomes available for common public, the registration can be done. The CoWin app has 5 modules: Administrator module, Registration module, Vaccination module, Beneficiary Acknowledgement module, Reports module. Common people will be able to register for the COVID-19 vaccine through the registration module by providing their photo ID. Beware of fraudulent apps. EVIN, Electronic Vaccine Intelligence Network, will be upgraded to CoWin, that is Coronavirus Vaccine Intelligence Network. Here's the link on how the CoWin app might look like. It's an old version. Continuing with the fraudulent app section. Be careful of the fraudulent app, says Government of India, as they will very soon let you know when the CoWin app will be launched. As of now, if you try to access cowin.gov.in or app.cowin.gov.in, then you will notice that it leads to 403 forbidden error. This means that the web page is not active. Government of India is working on it. Once the app is ready for general public, everybody will be notified on its launch as tweeted by the Ministry of Health and Family Welfare. Who will get vaccinated first? Indian Prime Minister Narendra Modi's government has identified 300 million people to receive the first doses of the vaccines. The priority group is made up of 30 million healthcare workers, policemen, soldiers and volunteers, and 270 million vulnerable people, mostly citizens above the age of 50, and 10 million others with serious comorbidities. The government is aiming to vaccinate 300 million people, a quarter of the country's population, by the end of this summer. The 2 approved vaccines in India's arsenal need to be administered in 2 doses, which means 600 million shots will have to be delivered in the next 6 months. Healthcare workers could get sick themselves. Also, people above 50 years of age, as we discussed, and those under 50 with comorbidities are vulnerable. Morbidity is the state of being sick or having a disease. Comorbidity refers to an overlap of different conditions. How to register for vaccination? One cannot walk into a clinic or vaccination facility and get vaccinated arbitrarily. The COVID Vaccine Intelligence Network system is a digital platform, and it will be used to track the enlisted beneficiaries for vaccination and COVID-19 vaccines on a real-time basis. At the vaccination site, only pre-registered beneficiaries will be vaccinated in accordance with the prioritization, and there will be no provision for the on-spot registrations. Remember, registration is mandatory for vaccination. The information on time, date and venue will be shared only after the registration is complete. The vaccination process and price. According to Serum Institute of India, Covishield could be sold to the Indian government for about $3 for 2 doses, and that's US dollar, and later to $6 to $8 on the private market. That's slightly much cheaper than Pfizer-BioNTech vaccine, which is sold to the US government for $19.5 for a single dose, although Pfizer India has not announced the price for India yet. Both the Indian vaccines will be administered in 2 doses as discussed previously, and it will be stored at standard refrigerator temperatures. Covishield has another advantage. It only needs to be stored at standard refrigerator temperatures of 2 to 8 degrees Celsius. Pfizer's vaccine requires an ultra-cold storage temperature of minus 75 degrees Celsius. And that's an infrastructure which India lacks and must be used within 5 days once refrigerated at higher temperatures. When and where will one get vaccinated? On 2nd of January 2021, India conducted a nationwide COVID-19 vaccine drill called Dry Run at close to 300 sites to familiarize officers on all levels with the operation guidelines. Around 120,000 healthcare workers have been trained on tasks such as verifying personal data, conducting cold chain and logistics management, and uploading information using government software. When will the vaccination start? Under phase 1 of the vaccination drive, the government is planning to vaccinate 30 crore people, that is 300 million people. Altogether, 23 ministries will be handling the process. They are Women and Child Development, Integrated Child Development Services, Panchayati Raj, Rural Development, Education, Ayush, Urban Development, Sports and Youth, State Police Department, Revenue, Public Works Department, Public Health, Engineering, Information and Broadcasting, Defense Establishments, Food and Civil Supplies, Social Welfare, Minority Welfare, Tribal Welfare, Animal Husbandry, Railways, Labor and Employment, State AIDS Control Society, Department of Power, and finally, Information and Technology Ministry. How are the vaccination sessions being held? Vaccination sessions will look like this. Number one session for 100 beneficiaries. Number 2, while most of the healthcare and frontline workers would be vaccinated at fixed session sites, vaccination of other high-risk populations may require outreach of session sites and mobile sites or teams. Number 3, state or union territories can identify specific days for vaccination. Number 4, conduct of the vaccination process. Similar to the election process, the vaccination team will consist of 5 members as follows. Number 1, vaccinator officer. They are doctors, staff nurse, pharmacist, A&M, LHV. Anyone legally authorized to give injection may be considered as a potential vaccinator. Number 2, vaccination officer number 1. At least one person, police or home guard or civil defense, NCC, NSS, NYK, who will check the registration status of the beneficiary at the entry point and ensure guarded entry to the vaccination session. Number 3, vaccination officer 2. It's the verifier who will authenticate or verify the identification documents. Vaccination number 3 and 4 are the 2 support staff who will be responsible for crowd management, IEC or communication and support to vaccinator. These links are the references used to prepare this presentation. If you like this video, why don't you drop one of these? Thank you so much.